65-year-old male complaints. Fever for 3 days. Cough with sputum. Increasing breathlessness. No history of trauma. No chest injury. On examination, temperature elevated. Respiratory rate increased. Oxygen saturation slightly reduced. Chest auscultation. Crackling sounds heard. Clinical suspicion. Lung infection. मैं हूं डॉक्टर अभिषेक और अब हम स्टेप बाय स्टेप समझेंगे न्यूमोनिया कैसे होता है, कैसे डायग्नोज करते हैं और कैसे ट्रीट करते हैं. What is pneumonia? Pneumonia is an infection of the lung tissue. Normally, alveoli, air sacs, are filled with air. In pneumonia, alveoli fill with pus, fluid, and inflammatory cells. As a result, gas exchange reduces, oxygen level falls, and breathing becomes difficult. Common causes. First, bacterial pneumonia, the most common in adults. The most common organism is Streptococcus pneumonia. Other bacteria include Haemophilus influenzae and Staphylococcus aureus. Second, viral pneumonia, caused by the influenza virus, SARS-CoV-2 or RSV, especially in children. A viral infection can damage the lung lining, making a secondary bacterial infection possible. Third, fungal pneumonia. This is mainly seen in immunocompromised patients, long-term steroid users, or HIV patients. Risk factors include elderly age, smoking, diabetes, chronic lung disease, alcohol use, and weak immunity. These conditions reduce the lung's defense mechanisms. First, the symptoms. Common symptoms of pneumonia include fever, cough, often with yellow or green sputum, breathlessness, chest pain, especially on deep breathing, and fatigue. In elderly patients, symptoms can be different, like confusion, reduced appetite, and weakness. In severe cases, look for rapid breathing, low oxygen levels, and bluish lips, known as cyanosis. Second, the clinical examination. On examination, a doctor may find an increased respiratory rate, low oxygen saturation, and hear crackles or crepitations on auscultation with reduced air entry in the affected area. These findings increase the suspicion of pneumonia. Third, the investigations. The most important investigation is a chest X-ray, which can show consolidation, lobar involvement, or sometimes pleural effusion. Blood tests like a CBC can show elevated white blood cells in bacterial cases, while CRP and procalcitonin act as infection markers. Oxygen levels are assessed using pulse oximetry or, in severe cases, an ABG. Diagnosis is confirmed by combining clinical symptoms, examination findings, and chest X-ray evidence. First, treatment depends on severity, age, comorbidities, and the cause. For the most common type, bacterial pneumonia, mild cases are treated outpatient with antibiotics like amoxicillin clavulinate or azithromycin for 5 to 7 days. Severe cases require hospital admission for IV antibiotics like ceftriaxone plus azithromycin. For viral pneumonia, if influenza is suspected, oseltamivir is given. Otherwise, management is supportive. Antibiotics are not needed unless a secondary bacterial infection is suspected. Second, supportive management. This includes oxygen therapy if levels are low, IV fluids for dehydration, paracetamol for fever, and sometimes nebulization or chest physiotherapy. Severe cases may require ICU monitoring, non-invasive ventilation, or even mechanical ventilation. Third, possible complications. These can include pleural effusion, lung abscess, sepsis, or respiratory failure. Early treatment reduces this risk. Fourth, prevention. This is extremely important. Get vaccinated with the pneumococcal and influenza vaccines, especially if you are elderly, diabetic, or have chronic lung disease. Lifestyle prevention includes stopping smoking, good nutrition, and proper hand hygiene. मैं हूं डॉक्टर अभिषेक. Pneumonia एक ट्रीटेबल कंडीशन है, लेकिन इग्नोर करने पर डेंजरस हो सकता है. अर्ली डायग्नोसिस और प्रॉपर ट्रीटमेंट से रिकवरी पॉसिबल है. सिम्टम्स को लाइटली मत लीजिए.